A very hazy day here in Milwaukee and a lot of other places across the U.S. because of all that wildfire smoke from up in Canada. Doctors, of course, are issuing health warnings over the air quality alerts that are in place. The alert for our area is in place until noon on Thursday at the earliest. Joining us now to talk about this a little bit more is Dr. Jeff Pothof, UW Health's Chief Quality Officer. How detrimental is this really to the average person, let's say?
I think to the average person, the air quality right now, it isn't great, but most people will do okay. They may notice some mild symptoms, maybe a little itchiness to the eyes, maybe an extra cough or two here or there. The folks we're more worried about are those who have underlying medical conditions, particularly respiratory conditions, people with asthma, COPD. Being outside for an extended duration on a day like this could trigger exacerbations of those conditions.
I mean, we're looking at these images on the screen right now of what the city looked like this morning. I mean, it was just kind of that eerie golden haze over the whole thing. I mean, what do you say to parents who have a lot of their kids going out to summer camps? I mean, I had my kids out at tennis this morning and they said to us, if it's really bad tomorrow, we might cancel. What is your advice here?
Yeah, I think, it's know your child. So if I had a child with a history of asthma exacerbations or difficulty breathing at baseline, I may hold them back from camp from today, maybe tomorrow. With that said, a lot of kids will do pretty okay with this. The more we can limit duration outside and certainly the level of exertion outside, the better off those kids will be. I think for most of us, with a day or two of this, probably no long-standing issues with it, but wouldn't be surprised if we do see a couple people, come to an urgent care emergency department saying, hey, it was just too much today. I need a little extra help here, and we end up treating them for some respiratory problems.
I was noticing a headache and kind of the back of my throat being out all morning. My kids were like, what are you talking about, Mom? I'm totally fine. So, like you said, you have to know your kid and make the decision based on that. We are just a week away from the July 4th to July 3rd. Fireworks are huge here in Milwaukee on the lakefront. Remind us again how common firework injuries can be this time of year, because I hate doing stories about people blowing off body parts.
They can be very common. Being an emergency physician, we're usually starting to take bets the beginning of our shifts on how many firework injuries we're going to see on the 4th. And a few things to keep in mind if you want to avoid seeing myself or my colleagues. One, maybe the most important, alcohol and fireworks absolutely do not mix. They don't go together. So if you're going to imbibe an alcohol, leave the fireworks to someone else. And then likewise, don't do the things that you know not to do, but might do anyways. Things that explode, don't hold them in your hand and see how long you can hold them before you throw them. That's a good way to lose a finger. Even kids with sparklers, small kids, I know it's fun to give them those sparklers. I've seen a lot of burns to feet when kids have those sparkler ashes fall on their feet. They get kind of startled. They drop the sparkler, and now they have that burning sparkler on their foot. They get a burn. Certainly if you get, severe burns or burns to your hands or feet where it's kind of around the whole foot, those need some special attention. You may need to see a provider to get some ongoing care for those burns, but guaranteed we're going to see some burns this year on the 4th of July.
Play it safe, but we know how the odds stack up. All right, well, let's talk, totally shift gears here. If you have high cholesterol at home, especially if you do not take or don't want to take statins, there is a new daily pill on the market, Dr. Pothof. How promising is this?
It has some promise. It's early. There's a study in JAMA on benzpenoic acid, and statins are still the first-line therapy. So cholesterol, if it builds up in your arteries, it can create plaques, and these plaques can suddenly rupture, and that's what causes heart attacks and strokes. So we have medicines called statins, like Lipitor, Crestor, that reduce the level of cholesterol in your blood. But about 15% of people will get really bad muscle cramps if they take this medication, so we can't have them on it, and they're kind of left hanging. This new medication, benzpenoic acid, reduces cholesterol levels by about 21%. That's compared to statins, which can reduce like 25 to 60%. But they are showing some reduction in these cardiovascular strokes in people who are able to take this alternative compared to those who couldn't otherwise take a statin to reduce their cholesterol.
Yeah, if there's no other option, this could be a good thing. All right, well, thanks for informing us about that. Very interesting. Dr. Pothof, we always appreciate it. Thank you.
Thank you.